we have dwelled deep to understand nature, and when the nature does not function the way nature would want to function, it really creates a challenge for the medical doctors, and this has seized most of the time our attention. We have selected a challenging area to which so far the medical science has not provided a clue with conservative measures, and the craving for a child is a natural urge for a woman. So, the business of artificial reproduction techniques is flourishing worldwide. On the other hand, when nature doesn't work according to the rules set by itself, we thought, let us find out what could be the cause. And we had some support from Charaka, the Ayurveda father, who had said almost all ailments arise from the faulty functioning of Pragnya. So we had also undertaken what would have Charak in mind as Pragnya, and this is further stipulated in Bhagavad Gita, where in one of the Upanishads it is said that Manahi eva Manushyanam Karanam Bandha Moksha Bhoho. So, if there is the cause in the mind, then its solution should also be sought through the mind and not by artificial reproductive measures. Looking into the physiology of man, we found that the men with normal count, when they went into depression following a stock market crisis, that time their sperm count also declined, and sometime it went to zero. So mind-body link was further established, and when the depression was treated with hypnotherapy, the sperm count reverted back to normal and they could conceive without further assistance. Other various causes of male infertility, like premature ejaculation, the excessive work leading to so much of worn out during the day and after the work hours, late work hours, and additionally aggression by the female partners are easily treatable additional causes for male infertility. The causes for female infertility really have made us wonderstruck. When we found that an engineer lady, while undergoing investigation for patency of fallopian tubes at laparoscopy, revealed that the fallopian tubes were white string-like structures. Why should these normal fallopian tubes, without any pathological sign, should have such a spasm? And we decided to verify by giving an intravenous injection of atropine. Eureka! Injection of atropine intravenous instantaneously release the spasm of fallopian tubes, and the tubes allowed the flow of the dye all the way into the abdomen. The lady, an engineer with 8 therapeutic sessions, conceived with normal measures without any extraordinary devices and assisted reproductive failures, and delivered a normal child. Even more fascinating is the immunological barrier. We have seen that when spermatozoa in a normal man are examined under microscope, they progress in a linear fashion. In a test described as cervical hostility by a scientist, UNER, was available in gynecology textbook as UNER's test. But hostility is something there in the mind. How would a sperm know that there is some hostility from the female? We wanted to verify, and when the sperm that was found normally moving was injected into a partner who had an immunological barrier, we found that the sperm then started moving in a circular motion round and round and round. This will certainly imperil its further forward motion and will not allow fertilization. This is published as Vyas's modification of UNER's test and firmly establishes that when the hostility between two partners can be circumvented with therapeutic hypnosis sessions, it is possible to reverse the immunological barrier. This is published in our one of the largest series in the world as 550 cases of unexplained reproductive failure, and the modified Vyas's test also has gone on the record on the annals of obstetrics and gynecology. We have devised a program that involves about 8 sessions of therapeutic hypnosis for unexplained reproductive failure, which will be available on request.